Thank you, Mr. Speaker. Mr. Speaker, I rise pursuant to Standing Order number 51-1A to make a statement regarding the COVID-19 pandemic situation that is currently ravaging this country. Mr. Speaker, according to the World Health Organization, as of yesterday, 22nd March 2021, there are 122,922 844 confirmed cases of COVID-19 and 2,711,071 deaths attributed to the pandemic across the globe. In Africa, Mr. Speaker, the World Health Organization reported 3,600,474 confirmed cases and 76,241 deaths, while in Kenya, Mr. Speaker, it reported 120,910 confirmed cases and 2,011 deaths. This represents almost double the number of confirmed cases and deaths that have been reported in Kenya in November 2020. Mr. Speaker, according to the Ministry of Health, these figures are continuing to rise at an alarming rate. Indeed, with the current patient demanding outstripping hospitals' bed capacity, there are fears that this country is in the midst of a third wave that is more deadly than the first two waves that we had experienced. Mr. Speaker, under Section 36, 38, and 42 of the Public Health Act, Cap 242, on rules of prevention of disease, power of entry and provisions for mounting national responses respectively, the Ministry of Health, through the Office of the Director of Medical Services, is empowered to require, and I repeat, any person owning or having charge of any land or any building or dwelling not occupied, or any person owning or having charge of tents, transport, bedding, hospital equipment, drugs, foods, and other appliances, materials or articles urgently required in connections with an outbreak, to hand over the use of any such land or building, or to supply or make available any such articles, subject to the payments of a reasonable amount as hire or purchase price. Mr. Speaker, in such a time as this, where this country is in a crisis, we demand that the provision of Public Health Act be put in full force, and that the Cabinet Secretary of Health use the powers that have been availed to him to ensure that no patient is turned away from any hospital, whether public or private, due to lack of space or bed capacity. Mr. Speaker, I wish to inform this House that in response to the escalating number of confirmed cases and deaths attributed to the COVID-19 pandemic, the Standing Committee on Health held a series of meetings with various health stakeholders that were aimed at getting a clear understanding of COVID-19 pandemic situation and charting a way forward. These include, but are not limited to, government agencies and departments, including the Ministry of Health, Council of Governors, Kenya Medical Practitioners and Dentists Council, KEMSA, Pharmacies and Poisons Board, Kenya Bureau of Standards, Kenya Medical Research Institute, and the Kenya Medical Laboratory Technicians and Technology Board. Representative of health workers groups, including unions and professionals associations at the county branch level, such as doctors, nurses, clinical officers, allied workers, and private sector representatives, including the Kenya Health Federations and Christian Health Association of Kenya, etc. Mr. Speaker, as a result of these meetings, I have the pleasure to inform the House that the committee, the Health Committee, has today tabled the first progress report of the COVID-19 pandemic situation, as well as the committee report on KEMSA. Mr. Speaker, in addition to this, last week, that is Wednesday, the 17th of March 2021 and Thursday, the 18th of March 2021, the Health Committee met with health workers representing groups, the Ministry of Health, and the Council of Governors to deliberate on status of the National COVID Vaccine Deployment and Vaccination Plan 2021. The statement of both the Ministry of Health and the Council of Governors have been annexed herein to the information for all the members. Mr. Speaker, the committee takes note that from the meeting last week, there appeared to be a high level of vaccine hesitant among health workers, which had translated into low uptake and acceptance of the vaccine among health workers. The committee notes also that the Ministry of Health has since opened up the vaccine to members of the public, thereby driving up the uptake. However, Mr. Speaker, in view of the fact that health workers remain uniquely vulnerable to infection, the committee notes that the Ministry of Health must put in place the necessary measures to increase the uptake and acceptance of the vaccine among special groups. Mr. Speaker, the Ministry of Health further needs to scale up efforts to sensitize the public, to raise awareness in this very important matter, so as to ensure that Kenyans are not left behind. The committee further recommends the Ministry of Health to use services of vernacular radio stations, local churches, to be able to raise more awareness on the need for Kenyans to accept the vaccine. The committee, Mr. Speaker, will continue to closely monitor the vaccination drive and will table a comprehensive report on the same at the close of the first phase, which is scheduled to take place in June 2021. Mr. Speaker, sir, further, to the above, I wish to inform the House that the committee is seized on a special audit report of the Auditor General on the utilization of the COVID-19 funds by county governments and is set to commence hearing with various county governments. Mr. Speaker, further to the above, the committee is scheduled to conduct a series of county visits aimed at assessing the level of preparedness for the COVID-19 pandemics by counties. A comprehensive report on the same will likely be tabled before this House in due course. Mr. Speaker, before I conclude, I wish to state that even as we struggle to tackle the crisis of the COVID-19 pandemic, it is important that health workers avoid falling into the dangerous assumption that all cases arriving at hospital are as a result of COVID-19 infections. We therefore appeal to the Ministry of Health to review all its treatment guidelines and protocol with a view towards ensuring that all patients receiving appropriate and proper treatment. Finally, Mr. Speaker, I wish to assure this House and this nation that the current COVID-19 pandemic situation is a matter that the Standing Committee on Health has and will continue to take very seriously. Mr. Speaker, I thank you.